Welcome to Soul, Light, and Body. Today is such a gorgeous day because you know what? We are alive and we need to give gratitude. We need to wake up this morning and just give that gratitude because we could breathe for another day. We got such a beautiful guest this morning, a glitter practitioner who is here to sprinkle us with some glitter. Her name is Dr. Nupi, and she's here to help us to really understand burnout because many of us today we really suffer from burnout. We tend to give more or pour more than what we really have in our cup, and that could lead to burnout. Many of us are in jobs that is draining us every single day. We are in relationships that is draining us every day. So Dr. Nupi is here this morning to give us some tools that we could put in our toolkit. That whenever we feel that way, we could always go to the toolkit and sprinkle that glitter on ourselves and to really help us along the way. I'm Karen Pascal. I'm a holistic health and wellness coach and a co-author of two ebooks with my sister Joan Williams. And Dr. Nupi, we just want to welcome you this morning for taking the time to sit with us. Joan?
Oh,
Yeah, welcome, welcome. And you're such an amazing person. And but today I would just like to say that would coincide with the topic we're talking about burnout is to take some time for yourself. It's okay. It's not being selfish. It's taking time for yourself so that you can keep your cup filled. So that when your cup is filled, then you can pour because we all give all the time, depends on whatever job you're doing. We give our family. Take some time for yourself. It's okay. So that you can continue to stay strong, show up in the world with power, and step into your greatness as well and be your best self. And as Dr. Nopi will talk later, to help us to find that fizz and flourish. My name is Joan Williams. I'm holistic health and wellness coach, and I also co-authored the two ebooks with my sister Karen. And it's just a joy to be here this morning because we planned this show together with you guys in mind so that we can bring greatness to you and empower you. We can lift you up. Those who might be feeling, I don't feel great. You might be working on a project and you want to give up. No, stay strong and continue moving forward. You will get to the end to being successful. Welcome, Dr. Nupi. We're so happy that you're here. You bring the joy, you bring the fizz, you bring the glitter, you bring everything that can share with us and the audience today so that we can all continue to stay strong and work through that burnout that we all suffer from at some point in time in our life, depends on job, family, whatever it is. And you're here today so I give us that lift that we can overcome burnout and just live life with greatness. So we're so happy that you're here today. Welcome.
oh, thank you so much. Oh my goodness me. I could listen to both of you. You've got such beautiful voices, and I'm just being nourished as I'm listening. I'm like, oh, this is beautiful. What a gorgeous way to start somebody's day. I mean, it's midday for me, and I'm thinking, oh, why, thank you. I love it. Oh, thank you. Honestly, I just wanted to say thank you so much for inviting me on, and it's an honor to be here with you and share tips and share,
Mhm.
my story almost, as well as, really truly, how did I become a burnout warrior? Because that's what I say about myself. Um, and it is possible. And everything you mentioned there, which is so important, the fundamental message is your needs matter. No matter who you are, no matter what profession you are in, no matter what age group, your needs matter. And too bloody right. Own them, protect them, and understand what are my needs actually? What does that mean? What does rebalancing my needs even mean? And when you've got the handle of that, oh my giddy aunt, that is when you are aligned with your passions, your purpose. That's what it's all about. And as human beings, we are all the same. And there are baseline needs. Everybody has those. And it's when you understand that and you bring it all together, that's when you stand in your power. And it is absolutely possible. Absolutely. And I'm so passionate about sharing this because I guess this defines how I've practiced as a doctor. It defines how I am as a person. It defines really, it's everything. It's what I bring to my doctoring. It's what I bring to coaching. It's what it's absolutely crucial. And I will never stop saying it, really. Your needs matter. Own them, protect them, stand in your power. Because you can. And you have every right to. You deserve that. So thanks for having me on.
Oh, thank you. Thank you so much for your kind words. And you are here today to nourish us as well and to pour into us that we could become the best. So I'll just read something here, your bio. Dr. Nupi Arora is a general practitioner, family physician in the UK with a career in medicine spanning over 2 decades. Wow. For the most, she has been based in the inner city practice and has held specialized lead roles in deprivation medicine, trauma informed care, child safeguarding, and domestic abuse. She's also spiritual and transformational life coach, author, public speaker, hosts 2 live shows on LinkedIn, and she energizes all of us, those around her, with her contagious enthusiasm, zest for life, and authentic nature. She is passionate about delivering whole person centered care to her patients and clients, advocating a root cause approach to health, and dives beyond presenting problems and taking into account the whole person in a context of their daily lives, their backstory, and their experience of what is important for human, a compassion and inclusive approach which fosters hope, healing, and transformation. Dr. Nupi shows others how to realign and replenish their whole self-help needs with her holistic prescription, the F-list, a framework she has developed from whom her experience, her learning, and her recovery from burnt out 12 years ago, and share ever since to bring the whole person centered care to her patients' community alongside conventions. Medical practice. This also underpins her 12 one-on-one coaching practice program, Finding Your Fizz, Flourish. Empowering high achievers, female professionals, to realign their whole self needs, taking them, realign, and also help them to find their fizzle, to fill their fabulosity and flourish again. Nothing like her more than seeing her feeling the light of fizz, sparkle, and energy, and helping one to return to their true self. It's really just magical. Wow. I like the part fizz and flourish.
Yeah, absolutely. And that's what it's all about because it's about when you recognize what lights you up, your passion. So what does find your fizz actually mean? It's your passions, it's the things that light you up. And I guess it's really taking a step back and going, am I doing the things that I love doing? Am I in alignment with my whole self, my physical health, my emotional health, psychological and spiritual health? Am I really in balance here? And you know when you're not, because that's when you get these lower vibration emotions, feelings. You're feeling tired all the time, exhausted, anxious perhaps, and there could be very good reason for it. It's about understanding how you navigate life in itself, because it constantly throws curveballs at you. And that's the fizz, it's that inner light within, and it never goes, never. And it's just about recognizing, okay, I might need to activate it here, I might need to tweak a few things on this side or this side, and you can amplify it. And that, I guess, that's how I describe it. And when I see, just from holding space with patients, this is what always used to happen. I would just teach the breathing technique, for example, grab some of my patients' hands and just hold space and do the breathing. When my patients would open their eyes, or when I'm talking to somebody, tuning in from my heart, and you see the light come back in their eyes, and I've not even done a prescription, I've not even really done the medical stuff yet. Blimey, I mean, that's the glitter. That truly is what I talk about. And that is just incredible. You can feel it. It's not just what I see in somebody's eyes, it's the feeling. I can feel the energy. That's what I call fizz tingle, because it's like goosebumps. And I'm like, oh my, and my patient can feel it, even if they don't know what it is. They're like, oh gosh, something's shifted, or oh, I feel all sparkly again, or something. That's what they always have said. And I am obsessed with, obviously, with glitter. So it's a combination of everything, really. But finding your fizz, it's allowing yourself to take a step back and go, how fizzy am I right now? Truly, am I in autopilot? Am I, Groundhog Day? Or am I actually truly living the life I deserve, which is full of joy and light and love and passion and meaning and purpose and fizz? That's what you're, that's it. And you don't have to not, you are, that's what you're meant to be having, nothing less. And it's showing other people, you know what? It's okay to put your needs first. It's more than okay. In fact, it's absolutely vital that you do. And that's not selfish. That is absolutely how you keep your fizz essence is what I call it, this unique inner light that just radiates from you. That's how you keep it topped up, because you can give. Yeah, brilliant. Lovely. Yeah, let's give everybody else my energy. Yeah, beautiful. But if you're not filling yourself up, you are going to just deplete. And you might not even know that. It can be insidious. And then all of a sudden, your body starts talking to you. You start getting physical manifestations of, oh, I'm not in alignment anymore, or I need to top myself up with more sleep, food, blah, blah, blah. And that's how you learn to recognize your mind, your body, your soul is all connected. Once you understand that, you can govern then what happens next, because you get to choose. That's the whole point. And this is everything I learned through my own experience from burnout, essentially. And I've kind of discovered more, learned more, and then brought it all into clinical practice, which is what I've been doing. And, if you don't have any fizz or fun in your life, you got to take a step back and go, how fizzy am I feeling? Really, truly? Am I waking up going, yes? Or am I waking up and going, oh, now there's another day again? No, you deserve more. I value that. Let's do it. Let's see what else we can do, because there's always a different way. And that's what I would always say to my patients, actually. It doesn't need to be like this. and it takes consistency. It's not a magic wand, but trust me when I say follow these steps, 6 weeks from now, you are going to feel better, irrespective to the medical stuff that's going on. That bit will sort. But the foundation of your health and well-being, that's what the Find Your Fizz and Flourish is all about, essentially.
Wow.
Wow. What a wonderful way to put that over,
Thank
because
you.
we all tend to give more
Hmm.
and forgetting about ourselves that we need also.
Yes.
You know,
Yes.
it's like
Yes.
it's like battery. It's like your phone. You know, um, I was telling someone someday, if we see our phone is on 5%, or our laptop is on 5%, we quickly go plug it in.
Yeah. Precisely.
But with our lives,
Precisely.
if we are running on 5%, we're not even taking notice to that.
No. No.
We're
It's
not
amazing,
taking no
isn't it?
right. We're not even taking notice that we are running on 5% to
Mm.
stop, take a look, pause,
Mm-hmm.
and see exactly what's happening in our lives. But our
Mm-hmm.
devices, we quickly plug them in because we
Yeah.
need them to serve us.
Yeah.
So just like how we could plug in our devices to get that juice back, we need to
Mm.
plug in ourselves to that universal energy so we could
Absolutely.
continue to have that energy flow within ourselves. And we
Absolutely.
need to set that boundary, know
Yeah.
when to stop,
Yeah.
when to say, well, you know what? Today, I'm going to take my time for myself. I'm going to
Yeah.
do my self care today. It doesn't matter what comes along. Today is my day. I've got to fill myself up. I've got to recharge myself today. And it's quite okay.
Mm-hmm.
It is.
It's quite
It is.
okay. Because you
Definitely.
owe it, we all owe that to ourselves.
Yeah. Absolutely. And I would say, I would take that one step further, actually. It's not, you know, this is a way of being. It's not, you know, certain aspects, sure, if you're finding your passions, your hobbies, which is one of my F's, fine, you set some time and choose to do it at a certain time. But the basics of your own health needs, this is not, okay, I'll just do it on this day and I'll catch up here. This is in, this is, these are the baseline needs we're talking about. This needs to kind of happen consistently, daily, and that's why I created the F list, because it is the basics and there is more in it, but it is, you have to have the awareness first. If you're not, when you're stressed, when you're not feeling well physically, emotionally, there's stuff going on with your health, the one thing that majority of people completely just forget about is the basic things like, okay, I've got to eat properly, I've got to drink plenty of water, must get a bit of fresh air. These are the things I'm talking about. They're the ones that go because your head's too caught up, or you're not feeling well, or something's changed in your health. And that is what you need as almost a prevention, as a sustenance. It's not a, oh, I might just do it kind of thing. You have that in place, you're far likely to then navigate the ups and the downs of life and health and everything else that gets thrown at you in a way where you actually are empowering yourself. And at every step of the way, you can flick that back to that zone. And that's the whole point of this. It's not, I don't say this and not either do it for myself, or it's learned and lived experience, essentially. And I was sharing with you guys actually just very recently that I've been butterflying around Pacific Daylight Time, and my sleep patterns have gone completely the other way. And I know I've kind of run a bit low on my sleep, but I've caught up on a different way. And I've chosen to do this because a lot of my contacts are stateside. I've got a lot of stuff coming out. So I want to make sure everything's ready. So I'm resting in the day. And that's fine. My body clock's changed to Pacific Daylight Time for a bit, fine. But it's being aware, oh my gosh, yeah, oh, I was feeling really exhausted the other day, and then tearful, or oh no, then the vulnerability starts coming through, and you're like, oh no, maybe I'm doing all the wrong stuff. I don't know. You start doubting yourself. And that is exactly what happens when you're not well. When you're vulnerable in that sense, it's really hard to remember I must do this and keep myself in balance. But if you've already, it becomes a habit that you're automatically sort of defaulting to that anyway, you're going to deal with that health issue a heck of a lot better, and you're going to heal a lot quicker as well. And that's what I sort of spend time with my patients sharing, especially when it's in line as a doctor. It's crucial. You really can shift through things like this. And take, for example, chronic pain. I'm not saying I'm going to cure somebody's chronic pain. Yes, I can do the investigations and find out, exclude certain things. But it's really showing somebody this chronic pain, how it affects the body. One thing leads to another. When you have chronic pain, for example, you feel exhausted. When you feel exhausted, you're more vulnerable, your mood dips. Your mood dips, your pain becomes more sensitized. It's a vicious cycle. Taking a step back, it's not just about painkillers here. It's understanding, what can I do to keep myself in tip-top shape and learn how to navigate this pain? Because a lot of pain is also fear. I don't know what's going on. Oh my God, it could be this, which will sensitize you more. And you can use certain techniques which will bring you back into balance. And believe me when I say I've had patients who've had chronic fibromyalgia for donkey's years, different reasons for chronic pain, who happen to come and see me, and they were on all sorts of painkillers and this, that, the other, and they weren't actually working. Of course they're not going to work. They're going to help, I should say. I'm not adverse to prescribing, of course not. But doing the F list over the course of the time, I think it's about less than 6 months, this patient was off pain medications. She was meditating regularly. She was painting again. I'm not saying she was not in pain, but she was coping with it, and she was accepting this is what her body is doing. So she's learned how to understand her body, understand what to do when she's feeling a certain way, as opposed to push through, keep pushing through. It's about waking up. It's about being aware, is what I would say. That's the fundamentals here. It's about awareness. And then you apply that, you really can start to shift and really do anything. And I guess I'm living proof of that, to be honest, as are my patients and all the stuff I guess I've been involved in. It works. It really, truly works. And I think that's why I'm so passionate about speaking about this, because I've seen it on a micro level with my community of patients, and I want to get it out there. I want to share this with more people. I want to share and show, actually, you know what? This is how you can do things. And it's my purpose, really. And I absolutely love showing and sharing this with other people, always.
Thank you so very much. That is so clear to us, because first we have to have self-awareness. Start us to start ourselves. And you were able to outline that practicing various modalities, your spiritual practice on others, even though you're in pain, because of your self-awareness, you will be able to understand how to move and shift in that space, which you can you to live your best life.
Yeah.
Tell us the backstory of why they call you a glitter practitioner.
Oh, that's my favorite bit, of course. So part of it was because I'm known for my glittery eyes, and when I always ever for years and years and years. And patients would say, if they hadn't met me before, they'd say, "Oh, can I have a follow up with the doctor with the glittery eyes," kind of thing. It's true. And then my little ones, the children who used to see, they used to call me princess. No, what do they say? Yes, Dr. Princess Aurora. You know, like the Disney princess. And I'd be like, yes, thank you very much, I am. And they'd come in with pictures, going, could you give that to Dr. Princess Aurora, please? And it'd be a picture, and it's like glitter everywhere. So I had, my room was covered with all this kind of stuff. And truly, it's what I was saying earlier. It's about what I call physessence, your unique inner light. When from holding space and you are tuning in from your heart, tuning into that person's needs and showing them one or two things. It's not, you know, breathing in itself, it's so powerful. And when I see that light come back into somebody's eyes, that's the glitter. And it's not just the light visually, it's the fizz, it's the energy, which is why I call this whole thing, I made all of this up myself, this is my own vocabulary, physessence, because it's the energy that comes with that, as well as the glitter and the light, and it radiates. And that's when you're in balance, or you understand how to bring that back and how to top it up and recognize when you're running low. And that's why I'm called the Glitter Practitioner, and GP essentially. So GP stands for General Practitioner, which is family physician in the UK. And so I was very creative and thought, I think I'm just going to call myself the Glitter Practitioner. Why not? So that's how it came about. Essentially, it's what I see in somebody. It's what I feel when I do this. Well, how I practice medicine, for example, or coaching. And I love my glittery eye makeup. So always, those
That's
are
so,
the three reasons.
yeah, and it makes you stand out. It makes you unique and very special,
Yeah,
because you're bringing joy and happiness to people. And there is where the magic is.
yeah,
It's
and
magical.
that's yeah, and I think, and that's it as well. And actually, what I forgot to say was, it was actually my patients would say, you have a way with words, or you were coming to see you, and I've not done a prescription, I've just done what I do, and we might do other things physically for the physical health side of needs. And you know, the number of and it's not about that really, but it's impacted so many people. And my patients, the theme of feedback would always be, it's like you sprinkle glitter with your words, it's magical. And everybody needs some glitter in their lives. And the backstory to that was this patient who, and bearing in mind, I worked in an inner city deprived area. This guy, he was in his 20s, proper gangster dude. So coming out from his mouth that everybody needs some glitter in their life, kind of thing, I was like, oh, can I quote you in my book, please? And he was like, yeah, 2 nights up. Yeah, go for it, man. Yes, brilliant, you know. And he had come from, you know, as what always happens, nothing happens by chance. It was on
Sure.
my emergency clinic. So nobody knows that I'm the duty doctor, essentially. Patients would pre-book with me for sure, and I'd be booked up well in advance. But on the book on day or the emergency clinics, I don't know who's coming in. I don't know what's going to happen. But it would always be people who needed what they needed. And lo and behold, I'm sat in that clinic. This guy comes in, never seen him before, brandly newly registered at our practice, background history of quite severe mental health issues. And I would question that, really? Is it mental health issues, or is it actually a product of deprivation? Is it a product really of the trauma he's had in his life? He's had, like, grown up with witnessing domestic abuse his whole life. Is that mental health, or is that actually trauma? And it's presenting as can't cope, anxiety, stress, etc. That's by the by anyway. So this guy had, you know, navigated through his life, growing up in a toxic environment, adverse childhood experience after adverse childhood experience, lost in the system of schooling, lost in the system of the whole education and social care, no faith in the professionals around him because nobody was doing anything. He'd had a really tough life, basically. And he'd seen doctors in the past who'd given antidepressants, which was the right thing to do, but nobody's addressing the root cause here. And I know this because I went through all the records and stuff. And so this guy presents to me, and he's really agitated, and because he's been waiting for a bit, and I remember it clearly because he came in and he was like, "Oh fucking hell, am I there?" And I said, "Hey, it's okay, you're here now. Okay, let's just have a chat. What can I do?" And he sort of looked at me and he was like, and then he just said, "Well, I've got this, and I've never seen anybody here, and I've, quite frankly, no disrespect to you, but I just find doctors a waste of time. He just gave me a prescription. Is that what you're going to do?" And I'm like, "No, I want to know more. Tell me about you." And he's like, "You're fucking joking. You serious?" And I'm like, "Yeah, I am. I want to know you." And I said, "I'm your doctor here today. You've got me today, and I want to know." And he was literally, I was like, nobody's ever spoken to me like that. Nobody's actually stopped and asked the questions. It didn't take me much longer. It took me 5-10 minutes to piece things together, what I've just told you, ACE's adverse childhood experience, where he's come from, what he's experienced, why he feels how he feels, simply from tuning in, and I could see it in his eyes and I could feel it. But also, that's why I'm the trauma lead, and that's why I've always been the safeguard lead, for example. And I explained it in a way to him, and I said, "Okay, so this medication is going to help keep you on a balance, but we need to do you, because this is all off kilter." And he'd been bounced between services. That was the issue, from one mental health services because it wasn't appropriate for them. So they're like going, "No, send them here." And I'm like, this guy has never seen anybody because you keep bouncing him. It's crazy. So I started work with him, it was just before the pandemic, actually. And then, so I did one face-to-face with him. And, every week, every few days to every week initially, because he was quite up here, brought it, he was doing what we would planned in terms of the F list and in terms of keeping on treatment, because that's what never happened. He never trusted anybody before. And, weekly check-ins essentially. Didn't take me that much longer. I'd say it was about a year to the day, actually. It was about by 6 to 9 months, he was, using the F list, and he's doing so much better. It was incredible. The year mark came and I was doing his med review and this, and I was just sort of saying to him, no, he wanted to tell me he'd just got like his first job. He's never held down a job before, all this stuff. And I was like, "Oh my God, that's amazing. I'm so proud of you. Well done." And he's like, "It's thanks to you." And I said, "Well, thanks, but it's actually you. You've done the work. You've taken it all on board. You were ready to do this, and you've understood why, and you're the one who's maintained it." And it was the first time he'd stayed on treatment, appropriately so, for that length of time. And I was sharing that back, and he said, "Well, it's because you explained it in a way that you didn't treat me as if I was just a piece of on somebody's shoe. You actually wanted to know about me, and your reference is brilliant and all of this." And he was like, I've never felt the way I felt, and that's because how you showed me." And I said, "Yes, but the doctors before did this." He goes, "No, I don't want to argue with you, doc. I hear what you're saying, but actually you sprinkle glitter with your words. You've got some magical effect." He was the one who said, "And everybody needs some glitter in your life." And this is on the phone. And I'm like literally in tears. I was like, "I can't believe you've just said that. Yes, it is magical. Oh my God, thank you. Oh, can I quote you?" And then it was beautiful. And that is too precious. That for me is why I do what I do every single time, because quite frankly, I don't give a damn about well, when I say convention, I mean, okay, we have 10 minutes, 15 minutes. It's never enough. Of course it's not. But this, if you're dealing with, a community where there are complex health needs, I'm sorry, scratch the surface with sticky plaster medicine. Don't even get me started. what's the point? That patient's going to keep bouncing back with different health conditions until you understand what's behind all of this, and actually what can we put in place to support that. I'm not saying wave away the trauma or wave away the past. We can't. What I can do, though, is show you here and now how to navigate it and how to strengthen up and find your fizz and start flourishing again, because you can do that. So, you know, that's the glitter, basically, in a long-winded way of saying. Sorry, I just totally started telling stories.
Thank you.
You know, thank you so much for telling that story. That's truly
powerful,
because that is what really happens when you really experience a coach. You get that transformation in your life, and it's a transformation for the rest of your life.
Exactly. And it's not just you. When that shift happens, when you see it, and then, you know, by week 3, 4, you're really feeling it, and then by 3 months, oh my God, yes. It's not just that person. It's that, and that's what I always say. It's my 3 favorite words: uplift, inspire, and empower. Because when that starts happening, the ripple effect of you being that translates to your circle, your circle around you. So say if it's a mummy who's come to see me, or a dad, whichever, male or female, it's going to impact your unit. It's going to change and break cycles of even generational trauma, because you're aware, and you're aware of your responses and all of this stuff. So you're shifting to the next, to further people. And then the ripple effect of that is it goes through friend to family to community. That's the impact this has. And, you know, that is just, yes, of course I'm going to do that. You know, it's too bloody right I will. Combining
the whole trajectory is changed.
Yes, and that's what I say, actually. You can change your trajectory. You can change your trajectory at any given time, because you get to govern what happens next at every step. And it might feel that I've not got a choice. You say, yeah, you get to choose. I don't have any choices. If you stop, take a step back and really look at it with support, obviously, as well, there's always a choice. There's always a flip side. It might not be the choice you thought about, or perhaps what you would like to have done. But if you never go there, you don't open that door and step in, you never know. And then the psychology of all of that is, and this is what happens, it becomes your norm. If you are anxious, stressed, or chronic health issues, that's all you know. So leaving that behind, it's not great, but oh well, I suppose it's better than anything else, so I'll just put up with it. But you don't know. And it's about accepting, okay, this doesn't serve me anymore. But everybody has to come to that realization themselves. And when you're ready, that's when you start to shift. You can kind of dip in and dip out. And that's why many, many times patients would say, oh yeah, well, I've had counseling and it never really worked. Or, yeah, I kind of did that, but it never really worked. And I'm like, okay, so tell me why. If you understand why it's not worked, what was the barrier perhaps to sticking with something? That's when you can start shifting somebody's perspective and going, it does work. I'll show you how. And also, I guess what's really crucial here is, and this is what really is my passion and why I get so fired up and it lights me up. I guess you're both carers as well, so I know you'll understand this. When you're in healthcare, you know, we look after other people's needs. You have to do you first, otherwise you're going to deplete, which we can talk about. But you're in a position of trust, essentially, and people will come to you because you are that healthcare provider. And specifically nurses, doctors, carers, you have that responsibility, which is why we came into the profession in the first place, and you get your training and all of that stuff. But there aren't any other professions really, apart from social care. You are allowed with this unconditional level of trust to step into somebody's life and actually see, if you choose to, and actually go there. That's unique to the profession, and it's these time-old skills of empathy, compassion, professional curiosity is what we really call it. And I'm a nosy bugger and I love to talk. And I'm curious about people. I love people. I always want to know more. I always have. But it's professional curiosity as well. It's a thing. And it's using and keeping that. But the difficulty is when you're frazzled yourself, you're exhausted as a clinician, I'm saying, or as a healthcare provider, and you're not able to look after your own needs, your bandwidth for stuff. I'm not saying you're going to do a bad job. It's not that. Very hard to care and give to somebody else if you're not doing it for yourself. And that's the point. So it's not a criticism on other clinicians at all, but I guess burnout is that's what taught me. That's what it taught me 12 years ago. And it's what I've maintained. It's how I still love my career and love what I do, 30 years down the line from entering medicine. So it's remembering why you went into the profession in the first place, I think, and why you chose to do what it is you're doing. And if that fizzle isn't there, then it's okay to pivot. It's okay to take a step back and go, okay, so what does light me up now? And I think, that's applicable to any career, not just, physicians or healthcare providers.
That's absolutely true, because many times we go to a doctor and it's just giving a patient another pill.
Yeah.
The doctors don't really sit with that patient and really get to the root cause of the problem. And that is where the healthcare system is breakdown.
Yeah.
Because that person is going through trauma, depression.
Alexa, stop.
And
sorry, that was doing my head
if we don't get to the root cause of what is causing that problem in that person's life, that person would continue to go through for the rest of their lives being on medication. Not saying that if there is a problem with you, you must go to the doctor, of course, right?
Yeah.
But the gap between, that's the very, very important part.
Yeah.
Because we all need to know what's happening in our lives. And there is where a coach comes in.
Yeah. Absolutely.
Because the coach able to help the individual to dive deep to really understand what really happening within that individual. And sometimes you don't need any medication.
Nope. And that's why
Right. Just really shifting your thoughts and just moving those negative thoughts away could really clear that path for that individual to really regain that strength and regain that great health within themselves.
Yeah.
So I really admire you for a doctor who chose to dive deep before you dispense the medication, because you really want to know, who is this individual? What is the problem with this individual? Why are you behaving this way? What's going on with your gut? So because you're taking the time to go deep into that, you really could see the individual and dispense holistic treatment to that individual, because you understand exactly what's happening with that person. And that's where the magic happens.
Yeah, absolutely.
And to put another layer in that is that you notice the person. People like to be noticed and know that here. Here, and as kind of said, you go beyond. Yes, you're a doctor, you prescribe medication, but it's much deeper than that. Who are you?
Definitely.
Who are you as an individual? And when you could just take the time, even just to ask that one question,
Yeah.
you get more. The shift already happened right there, because
Exactly.
well, nobody ever took the time to ask the specific patient you spoke about, to ask him those questions and to notice him, validate him, and give him that validation to know that you are somebody special.
Yeah.
And I
Absolutely.
who
Yes.
you
Yeah.
help me to understand who you are,
Yeah.
to help me to
Absolutely.
understand and where are you right now, and once you accept and acknowledge where have you been, what happened, and where are you now, then we can make that shift and move you forward to becoming spoke about your wholeness and
Yeah.
finding fit
Yeah.
and making you
Absolutely.
so
And making you fabulous again. It's true.
we
It's
just
so true.
flowers
Yeah.
today.
It
Yeah,
really is. And I think the it's incredible to be a part of.
mm-hmm.
And it's also, what you were saying, it's about you're validating somebody. And sometimes that's the therapeutic side of things as it is. And as you said, it's that first consultation sometimes that gains that trust. And people, nobody comes in with trauma written on their forehead, or this is what's happened in my
Sure.
life, or this is
Sure.
truly how I feel. It's what's the unsaid here, what is not being said when you're tuning in and you're listening from your heart. But what you're showing is that you're asking questions, because not because you're going through the tick box thing, or because you're just trying to get this thing done really quickly. You're asking a question because you actually want to hear the answer. And it's not just with your ears, it's with your eyes, it's with your senses, and it's with your heart. And that is where you're planting seeds that this person can trust you. And the majority of time, you trust your doctor. You go in because you're the first port of call. But I personally, I think this is just basic humanity, to be honest. It's compassion, it's kindness, it's love, it's unconditional love. But I guess it's how in tune you are with yourself as well. Because if you're, if there's work to be done, or you're not really in alignment, for example, you only will see it in one aspect, is what I'll say. It's difficult, it's not easy, but it's what drives me, and it really does light me up. And colleagues would say, oh, isn't it exhausting, you're getting all this, and I'm like, no, gosh, people transform, and that to me that's just magical, and I'll do that every single time because
Mhm.
it's needed. And that's how, doing the F list all these years and coming onto LinkedIn literally was like, it wasn't just like that. I've honed this for my whole career, and I knew my time on the ground almost was done. Not done because I'm still doctoring, but it needs to. I'm ready, and that's exactly what I said to the universe. And I was like, right, okay, I get it. I'm ready. I'm ready. Okay, thank you for sending me only those aligned with my heart and soul and my purpose and what you want me to do. That's grand. And thank you for keeping all the, oh, I better not swear, the idiot away, because no, I don't need that now. But I don't know how to protect myself and tune in and all of that. And that's exactly what's been happening in terms of what's happened over the 5 months on LinkedIn, is the fact that when you're truly authentic and you understand you understand your needs, you understand the needs of others, etc., you can actually tap into the universal energy. It's there for everybody. It's not just, oh, I'm special or you're special and people get to do this. No, this is accessible for anybody. And this is part of my F list essentially as well. It's a combination of everything. And it's how you become alive and awake. It's when you're truly aware. It's expanding your awareness. because with that comes this deeper understanding. With that comes choice. You get more possibilities of choice. You get the options. And then the beauty about all of this is when you understand your needs and you're owning them, you get to choose what happens next. And even further, of course, you can manifest it, but you can only manifest when you are truly in line with yourself and abundant with that. It just doesn't happen like, okay, can I have that now, please? Or I really want this. It's not going to happen like that, I'm afraid. But it's whether or not, are you ready? Are you ready to go there? Do you recognize that you're not okay, kind of thing? And it's almost like, here, take my hand, let's do it together, is what I would always say to patients, for example. And I'm like, you're not doing it on your own. But I can. I know in marketing speak, you can never really say this. And I would say this to patients that, I can't promise you we're going to get to the end point. I can't promise that. I can't predict what health condition is going to come up. One thing I can guarantee is you follow this, the F list, the framework, balancing your needs. I can guarantee, give me 3 weeks, 6 weeks of your time, you're going to feel better. I know that. I'm sharing my story for that reason. And it's true. And then you can go even finer with it. And people might say, yeah, well, I'm doing that and it's not really helping. I'm like, are you doing it? Are you mindful when you're doing it? Truly? And then it's looking at where the barriers are and sussing it out again. And then the deeper you know yourself, the effortless takes a life of its own, essentially, because you're shedding layers, you're shedding these limiting beliefs, and then perspective changes, and then your growth starts happening. And it's just, it's incredible. It's incredible, the power of the mind, the body, the way it all connects. And when you learn how to tune into that, it's absolutely, it's incredible, and never fails to get me all excited, and I love it.
That is incredible, because what you're doing, as you explained earlier, is you're helping someone to rebuild.
Yeah.
You're giving them fresh pillars to step and move themselves up to be the true self of the individual. So, but I think it's open-mindedness.
Yeah, it is. It is.
And allow the universe to come in, give, and give to them.
Absolutely.
So they strong and use those pillars and build.
Yeah.
Strong individual and be world.
And I think people, I used to say this as well when say a patient came in, and I'm giving lots of patient stories because it's slightly different to coaching clients, actually, but it's just to really highlight the impact this has, in the sense of, it's not about preaching spirituality to everybody and converting everybody. It's not about that. And holistic care means, and spirituality means different things to different people. But how I kind of get through all of that is, it's being aware of you, your needs, yourself, as well as the needs of the others and the world around you. And once that starts to shift, that's when the magic starts to happen, and you can tap into that. But it's also, your full health. It's mind, body, and soul. You can't just have physical. It's physical, emotional, psychological, and spiritual. And even if somebody doesn't even know about those two, it's fine. The mind-body connection, I'll work with that. Because when somebody starts to feel better, they start to feel their energy lift. They feel their emotions change. They start living their best life again. I don't need to explain that little bit there. It happens as it is. Or somebody will come in and feel the energy in my room. Or when I'm talking to clients, coaching clients, they will feel that fizzle and this, and all of that is it's incredible. And you don't need to have the words to explain. You just see it, and you tune in, and it just happens. Or somebody might see crystals in my room, let's say in my consultation room, or they might see something like angel feathers or this, and they're like, oh, Dr. Earl, that's lovely. And I'm like, yeah, that's right. Yeah, I didn't know you're into that. I'm like, yeah, absolutely. Of course I am. And it's just by the by. But then that's because burnout is exactly what that opened up for me, and here you go. And that's developed over the years, of course. But once you're open to this, and once you are, expanding, and you're shining like that, or you're spreading what you know and passing it on, you can't go back. You can't push that all back in a box and go, right, okay, let's go back to just doing it on a base level. I can't. No chance. And I think that comes with your development, and then it's learn, grow, evolve, pass it on. And that's where the cycle comes. That's exactly it.
That is absolutely true, because many times we keep going in a loop all the time,
Mm-hmm.
And many times we're asking ourselves, why is this happening? But
Yeah.
we're only asking ourselves the questions, but we're not doing the work to know exactly what's happening with ourselves.
Yeah. I would ask the question, what am I missing here?
Right.
What is this trying to show me? So instead of it's changing the mindset of, and this happens until you've more on a deeper level here. Now I'm talking not physical health. Things might keep recycling because that's the lesson that you're meant to be learning. And if it's not fully learned, you've evolved, you've grown, and then you're on to your next lesson in life, whatever, it'll keep happening in different shape, way, form. But the baseline, maybe the message or that lesson, is going to keep on presenting itself to you, or you're going to see it mirrored in somebody else. That's again another sign that, okay, what do I need to work on in me? Because this is triggering me talking to you, or it's making me feel a certain way. Why is that? And it's remaining curious. What is it I'm missing here? What is it I can take from this? What is it I can learn from this? And when you keep your mind in that sort of respond mode, as opposed to everything bad's always happening to me, and here we go, here's another thing, oh my God, everything's going wrong. Well, your energy around you has dropped, your frequency, your vibration is pretty low because it's the negative emotions. And that's the force field you've got out around you, and that's what you're going to keep attracting. Once you understand that, and I'm not saying let's all be positive Pollyannas here and go, life is wonderful, let's all start skipping around, yeah. No, it's about being curious, to delve and look at what the flip side could be, and actually, what else could this show me? What else could this mean? And with a good coach or a friend, support, that's exactly it. You hold a mirror up, that's what coaching is, and it's reflecting back and then helping somebody really understand. And that's where you start to see the shift. So, and it's all the mindset, it's perspective, and you can't just flick that. You have to understand, oh, what's that feeling I'm getting? I feel really uncomfortable. Hold on, why? Am I stressed? Am I this? What is it my mind is trying to tell me here? What am I trying to protect? Because these are protective mechanisms that you've probably had ingrained, and it stems right back from childhood. So it's understanding where it's all coming from to then adapt again, and then you can grow forward. And I don't know if that makes sense or not, but
It
that's what
does.
I'm trying to say. Yeah, okay, good.
A lot of
yeah.
sense.
Mm-hmm. Yeah. Wow.
You were phenomenal. Giving us those
We
glitters to sprinkle on ourselves, and us to understand all about ourselves and how we can make these changes. And once we can make that change, we could get this ripple effect.
I don't know if it can you guys hear me still? Well, yeah, absolutely.
Yeah.
I think the connection, I don't know whether it's mine or yours, but I can't really hear you guys.
Yeah, it's in and out.
Yeah, I can hear you actually, Joan. It was Karen's I couldn't hear. Can you hear me still?
I can hear you. I
Okay,
don't,
cool. And I can hear you.
uh,
Absolutely. And it's, one thing I really want to just really point out, because there's people watching and listening. It's not that everybody, just because I'm saying this, it's that I've got it all sussed and sorted. No, I bloody don't. I've learned what I've learned. You are always learning and growing and evolving. Always. It's how open you are at each step to remain curious, to challenge certain beliefs, etc. Nobody has a perfect life. It's not real. But you
right.
can create a life that you are absolutely deserve, is what I wanted to say, which is full of light and love and joy, passion, fun. And it's almost having that inner compass within you to go, okay, I get it, I'm not in balance here. What do I need to do to bring that back so I'm in line with my passion and purpose? And it might change, and that's fine. But if you're never questioning that yourself, or you're not picking up the cues in your body and in your mind, which is what it's trying to say. So, say you're in a job that you hate, but you have to do it. Fine, 9 to 5, that's going to serve me for now. What's stopping you from going, okay, this isn't working for me, so I'm going to start trying to pivot? Why put up with something, is what I'm trying to say. So it's being, but it's difficult when you're not feeling great in yourself. You're going to just go, oh, I'll just keep going. And I guess what I'm saying is, no, you deserve more. You so deserve more. And the title of my book actually is Be You with Bells On, because that's what I said to my therapist. I had chemotherapy. It was incredible. It was amazing. And towards the end, he was like, look, we're really scratching the surface here. I don't think you need to come anymore. And I was like, I know, but I love having these conversations. It's wonderful. And he said, I can see you're much better. And I was like, yeah, I feel so much better in myself. Absolutely. But I said, what did I said, I'm me again. And then I went, no, actually, sack that. I'm not just me. I'm me with frigging bells on, is how I feel. And it's
Exactly.
like all singing, all dancing, or etc. And that's what I used to say to patients and clients, in fact, of I don't accept, yeah, I'm okay. I'm okay. No, I don't accept okay. I want you to be you with bells on when you come back and tell me how you're feeling. That's what you deserve. And that's actually the name of my book that I'm going to get out next year, which is about my burnout and the F list, but actually showcasing case stories, patient study cases, really, to show the impact of this work. Because there's just so much, and so much people, I think people could really recognize themselves perhaps in one story. These are all real life, etc., all anonymized, and I've already had what's the word, permission, consent.
Wow.
Yes.
And you can, I'm just gonna have to cherry pick the ones, because there's loads, but it's not just the big things of transformation, it's the small things, like
Yes.
somebody being able to actually leave the house for the first time in like however long, because they've gotten over something that was really holding them back. I mean, that's huge to me. There are all lots of different examples where it showcases actually what is possible. And if that gives hope to somebody else listening, reading, then that's good enough for me, quite frankly. And that's why I'm on LinkedIn, to raise my profile and have a platform where I can share this, because for the last 17 years of my career, my community have always known this is what I do, how I do it. That's why they come in and see me. Big wide world doesn't know who I am. They don't know who the Glitter Practitioner is. And I guess that's why I came onto LinkedIn, to extend that reach. And that's what I'm doing. And the live stream shows I have, I love them. Love showcasing other people who are doing very similar. It's holistic care, and it's aligning with like-minded, like you guys. It's soul connections is what I call it, or gangster soul connections. You're a bit kick-ass, a bit badass, you know, bit of a disruptor, whatever you want to call that. Yeah, too right. Why not? And it's incredible, the connections and the friendships I've made since being on here. You guys, we met in comments on Yermi's show, for example, and it's just, and Diana, I met her in comments. In fact, I met quite a few people in comments because I'm chitter-chattering away. Yeah, it's amazing. It's incredible.
It's a true honor because you're helping all of us to grow and expand and
Oh,
evolve in our lives, because we all need that. We don't need to be
yeah,
complacent. We want to
yeah,
receive the greatness and
yeah,
also evolve and live our
yeah,
best, show up in the world.
yeah.
Be,
And you learn off each other. You know,
yeah,
I've learned from you guys. I always, and I think that's the key here. So, to when I was saying before about, it's not because I've got any special skills that are any different to somebody else. I just know about it. I've learned, I've gone through my stuff, and I'm teaching other people. But we've all got that the capacity to do that. That's the whole point. And it's not easy. And it doesn't come with just one day you just do it. But it's every what would I say, every conversation, every meeting, every anything, it's not by chance. There's something always there, and you learn from each other all the time. That's the thing. And it's whether you see that yet or you don't, but maybe a bit later down the line you'll be like, oh my god, yeah, I get it now. That's how I view it anyway. I'm not saying everybody needs to think like this, obviously, but that's how I see it. You do learn from each other.
Karen, is she frozen? Yeah. What would be one thing that someone who's suffering from burnout today could start with?
I didn't say again.
Someone who's suffering from burnout, I
Yes.
know. What is one thing their takeaway, or a few
Okay.
things
Yeah.
today start taking those steps?
So I would say recognizing that you're not feeling okay, recognizing you're fatigued, you're forgetful, you're governed by all of these emotions. One thing I would want people to take away from this is your needs matter. Full stop. Your needs matter, and especially with physicians, because we're very used to putting other people's needs first, and just that's what we do. You don't want to say, it's like this fear of, oh, I'm not good enough if I can't cope, and oh, I can't say that I need help. No, your needs matter. End of. Understand them, own them, protect them, and stand in your power, because it doesn't need to be like this. And I would just keep saying that please reach out. Please, you don't have to do this on your own. There are so many organizations, free services, especially for burning out physicians. You know, Diana's thing, physician coach support, and then we've got Olivia Morris, who's doing in the UK, is doing amazing stuff. Dominic Corrigan, who's doing amazing stuff with physicians, setting up free services to support other physicians. And it's people like me or other coaches, physicians who've usually they're the ones who've experienced it, burnt out, but bounced back through it. And that's why I say I'm a burnout warrior, because that's never going to happen again, because I know exactly how to keep my needs in balance. Might not always do it, that's different, but I do know. And I just, please, your needs matter. End of. And it is not weak. It is not a sign of not coping. Please ask for help, because there's help there. It doesn't need to be like this.
Yes.
That's what I would say.
That's so important. And your information has been there, and people who would like to reach out to you
Yeah.
Connect with Dr. Nupi because she's got so much of value and can help you if you have a situation you just like to reach out and talk with her. She's amazing. So
Oh,
Okay. Thank you so much, Dr. Nopi, and thank you to all the viewers that join
thank
us.
you.
Thank you for your beautiful comments. We will go ask any questions that you've asked. Dr. Nopi, myself, and Joan, we will.
mhm.
I never got to tell you about the F list, what it is. We never even got there, did we?
We're having you back.
Yes. Yes. We'll do a
Yes,
part 2, and the part 2 follow-up could be, okay, so we've had that discussion. Now let's talk about the F list and how you actually put it into practice.
exactly.
Yay! Let's do it. Oh, thank you. I just wanted to say thank you so much for having me on. I've loved it. It really has been amazing. Thank you, and thank you.
Thank you. You have nourished us so much today. So thank you. It's Karen. She's frozen.
Yeah.
Yes. We just thank you so much for gracing us today. And thank you to all viewers in the audience for coming and sitting with us. And we designed this show together with you in mind so we can bring you all the good stuff that can help you to continue to live your best self. So thank you. Tom?